Hi, I'm Dr. Kivett from Santa Rosa, California, and I'd like to speak to you today about acute wounds of the hand. I'm board certified in plastic surgery and dermatology, among other fields, and I had a fellowship with an orthopedic and a plastic hand surgeon, each of whom had their practices restricted to hand and arm. I'd like to speak today about the acute wounds of burns, lacerations, and crush injuries. Burns have many causes, whether it's a flame burn, heat, a scald burn, a burn with a chemical, electrical burn, radiation burn, frostbite. All of those things have several things in common. One is depth. A primary burn is that of the outer layer of the skin. The second degree burn causes blisters at the junction between the first and second layers of the skin, the epidermis and dermis. And then there's a third degree burn, which involves the deepest tissue, the subcutaneous tissue. And so the first two types of burns, of course, hurt a great deal. The full thickness burn burns the epidermis and dermis and the subcutaneous tissue. And so there is no pain because the nerves have been burned. And then finally, there's a fourth degree burn, which is deeper, which goes into the lining of the muscle, the fascia, the muscle itself, some of the surrounding structures of nerves and blood vessels, the lining over the bones, the periosteum. And so these all have their own implications. Infection will take a superficial burn, like a first degree burn of the outer layer, the epidermis, and convert it to a second degree burn simply because there's infection that renders the tissues not to heal as well. And so the burn injury automatically increases. Full resuscitation of the patient is needed. Have to pay attention to all of the organs in order to have the patient be healthy enough to heal the burn wounds. That involves debridement, that is to say, to remove any burned tissue, because it's not going to come back to life once it's been burned. It needs to be removed. Pain needs to be absolutely controlled. Creams are used, especially in burn units, to help heal the wounds prior to placement of skin that's taken from another part of the patient's body or from another individual, or from a laboratory that will culture their skin cells. If there's any question, then a patient should be in a burn intensive care unit based on body surface area, overall health, quality of the patient's life at that age, and other factors. Scars are expected to be present and can be helped by using pressure garments and splinting on these areas. And that's down the road after the wound's healed. Chemical burns can have an implication in that some chemicals will actually penetrate very deeply. And so they need to be treated in certain ways with injections of certain chemicals to offset the impact of the original chemical on the skin. Electrical burns need to take into account the fact that electricity is changing the electrical portions of the nerves of the body and can be way more damaging than even the initial electrical burn to the skin. Scald burns usually carry, until they're deep enough, a huge requirement for pain control. Radiation burns have both short and long-term consequences, similar to those that we saw with the atom bomb injuries in Japan and in nuclear accidents. Frostbite burns need to be resuscitated slowly with slow amounts of warming water, slowly warming, not quickly, and with intense attention to pain control. We change to a different subject, lacerations or cuts, as opposed to abrasions, which are very superficial removals of the outer layer of the skin by scraping, like scraping your knee on a sidewalk. Lacerations, however, cut through the first layer of the skin, the epidermis, and through into and beyond the dermis, the second layer of the skin, which is the support layer of the skin. and usually those need more attention. So depending on the depth, the location, circumstances, the contamination, the psychological adaptation by the patient, there's a lot of consideration. But in common, it's mostly important to restore the function by suturing, by avoiding infection, by closing the wound completely where possible, and then post-treatment care for the long run. It's also important to know what's not hurt so that one doesn't go beyond what needs to be done. The next area of concern is crush injuries, and these can be devastating because the crush is a pressure that's applied, and the skin and the tissues inside can literally explode when the pressure is great enough. That explosion will lead to a laceration, can lead to fracture, can certainly lead to infection, and can lead to an increased pressure within the compartments of the arm, which are seen in the upper versus the forearm versus the hand versus individual tissue and muscle spaces within the hand. And in those situations, absolutely immediate opening of those compartments is important to prevent what's called a compartment syndrome, which, if untreated immediately, can easily give rise to a contracture so that the muscles become stiff, contracted down, and unusable on a permanent basis. If you have an experience with this, please feel free to leave a comment or question. Please feel free to share it with family and neighbors. Make sure to give us a thumbs up if you liked what you heard today. And of course, if always possible, please subscribe so that we can continue to provide this educational service. Thank you for listening.